Okay, so based on the history and examination, we diagnose you are having gingivitis, a gum disease. So, Miss, are you aware what is gingivitis?
No.
So basically, let me explain. Gingivitis is an oral disease that commonly occur, and it affects the supporting tissue of teeth. So the supporting tissue here means is the gum. So the major cause of gingivitis is having a plaque. So the plaque basically normally it adhere to the tooth surface. It appear, we can say, as whitish, and it is sticky. And normally we found it along the gum line. So when this plaque stay in a long period, it will the bacteria within it will produce toxin and cause inflammation to the gum. So at that moment, you can see the gum becomes swollen, and when you brush your teeth, you will become bleeding. So if this happen in the longer period, you will have first recession. It means that your gum become go downwards, recede, and this expose the root of the root surface of the tooth. So your tooth become sensitive to the hot and cold food or drinks. And third, your tooth become loosening, mobile, and lastly, you might lose your tooth. The factor that will contribute to gingivitis is firstly if you are smoking. Secondly, if you have systemic disease, for example, diabetes. And thirdly, if you take certain drugs, antihypertensive, to control your blood pH, you have hormonal changes, pregnancy. So, this gingivitis can be prevented by proper toothbrushing. So all the exposed tooth need to be cleaned well, and also it includes the outer gum line, inner gum line, chewing surface, and also the most important part is area between the teeth. So now I want to teach you about the proper correct technique of toothbrushing. So firstly, we need to choose the proper the correct toothbrush. You need to choose a soft bristle, and also head of the toothbrush need to fit in your mouth. And also don't forget to use fluoridated toothpaste, as this can help you to prevent caries. So now for toothbrushing technique, it is better to brush your teeth in front of a mirror, so that you know what whether you are doing the right thing or not. So firstly, place the toothbrush 45 degrees towards the gum line, like this. And then before that, I want to say that we need to brush the upper teeth first. Okay, place the toothbrush 45 degrees towards the gum line, and then make a vertical motion from upwards to the downwards, like this. So start from the right, and then keep brushing to the midline, and then to the left one. Done. Then proceed with the inner side. Also the same concept, 45 degrees, and then proceed from upwards to the downwards. Brush from right to the midline, like this, and then to the left one. After you clean the upper one, proceed with the lower teeth. For the lower teeth, it use the same concept as well. Place your teeth 45 degrees towards the teeth, and then but for the lower teeth, make a vertical motion from downwards to upwards, like this. So you need to brush your teeth from right, and then midline, and then left one. Also proceed with the inner side, 45 degrees, and then from upwards to from downwards to upwards, left, and then for the midline like this, and then left one. Also, before that, I forget to tell you that you also need to brush the chewing surface. If the chewing surface, just brush it like this. Also from the left, right, midline, and then for the left one. Do it also for the lower teeth. But the lower teeth, it might be difficult as the presence of tongue here. But never mind, just do it slowly. During the tooth brushing, you might see that your teeth become bleeding. But don't worry, just keep brushing in a gentle motion. How many times do we need to brush our teeth?
2 times.
Yes, 2 times. Before in the morning and
Before sleep.
before we go to bed. And we need to brush our teeth in how many what is the duration?
I don't know.
No, okay. So we need to brush our teeth within at least 2 minutes. And okay, and if at that time if there is presence of bleeding, just keep brushing. And we should change our toothbrush every after 3 months. Next, we talk about the interdental cleaning, because toothbrushing only is not sufficient in order to remove the area between the teeth. So because of that, we need floss. So floss, just have a long floss, and then hold the end of the floss like this with both of your hand, and make it tight like this. And then slightly, slide the floss at your teeth. Can you hold? Okay. At the between the tooth, from up to down, and then make several times, 2 to 3 times, up and down, and floss between both sides. Okay, and then after that, you need to slide it up. Okay, during the flossing, you might see that your gum bleed as well, or tender. You feel pain, but it's okay. But actually, it is sign of inflammation. That is sign of inflammation, gingivitis. So we need to treat that. But it's okay. Just keep flossing. For alternative for the flossing is you can use floss. What we call that, floss holder. Okay. If you have a spacing at your teeth, between your teeth, you might also use interdental brush. Interdental brush, this one. So it has various size. How to use it? Firstly, you can put the brush between the teeth and push it insert the brush towards inside, and then also push for several times, 2 to 3 times, in order to remove the plug. We might also bend the toothbrush a little bit in order to improve access toward the teeth at the back, so it will become more easier. So as a conclusion, in order to prevent gingivitis and to have a healthy teeth, firstly, do proper tooth brushing. Secondly, don't forget to floss your teeth. And if there's spacing, you have space between your teeth, you can also use interdental brush.